Hi, my name is Jaclyn Porter. I attend school at Auburn University in Montgomery, and I'm taking a class, Survey of Exceptionalities. We were asked to choose a topic of interest and research it and do a video about it. I chose developmental delay, so I hope that this information is helpful to you. Developmental delay is any significant lag in a child's physical, cognitive, behavior, emotional, or social development in comparison with the norms. Genetic and environmental factors are both linked to developmental delay. Genetic factors are children are at a great risk of being born with a genetic or chromosomal abnormality. Environmental factors result from harmful agents. This can happen either before or after birth, and it includes things like poor maternal nutrition or exposure to toxins such as lead toxins or drugs. Also, mothers can pass infections to their babies during pregnancy. Some of those infections might include things like measles or HIV. A child's life experience is also another factor. Children that have poor nutrition or maybe are born prematurely, this increases their risk factors for developmental delay. There are some common characteristics for developmental delay. Gross motor characteristics would be the child has stiff legs and or arms. They use one side of the body more than the other side. They have a very clumsy manner compared to children of their same age, or they may have a limp or floppy body posture compared to children of the same age. There are also vision characteristics with developmental delay that you could look for. They seem to have difficulty following objects or people with their eyes. If they have difficulty focusing or making eye contact, if the eyes appear to be slanted or crossed, that's a sign to look for. If they bring objects too close to the eyes to see, or if they turn or tilt their head in a strange position when looking at people or looking at objects. There's also hearing characteristics with the developmental delay. They can talk in a very loud voice or a very soft voice. They may have difficulty responding when being called from across the room. They don't startle to loud noises. Their ears may even appear to be small or deformed. And if the child fails to develop sounds and words that are appropriate for their age, that would be another sign. Now, developmental delay is identified through two types of play assessments. There's a developmental screening and developmental evaluation. Developmental screening is a quick test that measures skills. This test is done to decide if the child needs further evaluation. There are two forms. There's the questionnaire form and then there's the test format. The questionnaire format is filled out by a parent or a child care provider, and it asks about developmental milestones of the child. The test form is given by given to the child by a health or an educational professional, and diagnosis cannot be made by using a screen test. If the results show signs of developmental delay, then the child is referred for a developmental evaluation. Now, with the developmental evaluation, it has to be administered by a highly trained professional. The evaluation is a long and in-depth assessment of the child's skills. It's used to create a profile of the child's strength as well as the child's weaknesses in all developmental areas. Results are used to determine if the child needs early intervention services and or a treatment plan. Now, local agencies in Chilton County can help you. There's also areas around Chilton County that could be beneficial. Birth through age 3, the Alabama Department of Rehabilitation Services, and their number is 1-800-441-7607. Central Alabama Therapy Services, their phone number is 205-290-4559. Alabama Institute of the Deaf and Blind could be helpful in developmental delay. Their number is 256-761-3737. There's a private agency, the Easter Seals Pediatric Rehabilitation at 205-621-6503. And then after age 3, special education services can be provided through the Chilton County Board of Education, and their telephone number is 205-280-2900. I hope that some of this information was helpful to you. Thanks so much.